Have you ever wondered what really happens to your body when you ejaculate every single day after the age of 50? I'm not just talking about the experience in the moment, but what takes place afterward, when the rush fades, when the body resets, and when the mind quietly processes what just occurred. Maybe you've noticed small changes, a little more fatigue than usual, less motivation, a shift in mood, or maybe you feel completely fine, calm, relaxed, even satisfied. But still, you can't help but wonder, is this habit helping me or hurting me as I age? Hello, I'm Dr. VENA Malik. I'm a board-certified urologist and pelvic surgeon, and I've spent years working closely with men navigating midlife and beyond. In my practice, I've seen thousands of men in their 50s, 60s, and even 70s, men who are strong, intelligent, and deeply curious about what's happening to their bodies. And more importantly, they're ready to understand themselves without shame. Today, I want to have a conversation that most doctors never do, a clear, honest, and grounded talk about what daily ejaculation actually does to your body after the age of 50. By the end of this video, you'll have a much deeper understanding of how this habit influences your hormones, your mood, your energy, your prostate, your emotional well-being, and even your sense of connection. You'll walk away not with fear, but with clarity, equipped to make decisions that support your health with intention, not confusion. So let's begin at the most obvious point, the release itself. The moment of climax. When you ejaculate, your nervous system enters a temporary state of overdrive. There's a sharp increase in heart rate, blood pressure spikes, your breathing becomes more rapid, and then comes the neurochemical cascade, dopamine, oxytocin, serotonin, all released in a beautiful wave of pleasure, satisfaction, and emotional calm. This is your body's reward system at work. It's natural, it's designed for survival, and it's powerful. But here's what many men over 50 don't realize. After that wave passes, your system doesn't simply reset back to normal. It dips. That spike in dopamine is followed by a drop. The heart rate slows, your muscles relax, and your brain enters what's called a refractory phase. This is the recovery window after ejaculation. And as you age, this window gets longer. Your ability to bounce back doesn't just take minutes anymore. It may take hours or longer, especially if your baseline hormone levels, like testosterone, are already lower. And that's where the first key insight comes in. Your body needs more time to recover between ejaculations after 50 than it did in your 20s or 30s. That's not dysfunction. That's aging. That's biology. And when you ignore that, when you push through it every single day, your system may slowly start sending signals that it's under strain, even if you're not consciously aware of it. Now let's talk about what's happening underneath the surface, specifically to your testosterone. Testosterone is your body's fuel for strength, mood, mental clarity, libido, and emotional confidence. It is the hormone that gives you that deep sense of, I feel like myself. But as you pass 50, your testosterone naturally begins to decline. That's expected. But how rapidly it declines, and how strongly you feel that drop, can depend a great deal on your lifestyle. One major influence? Prolactin. This is a hormone released after orgasm. It's part of what makes you feel satisfied, sleepy, and content. But when prolactin levels stay elevated, especially with daily ejaculation, it can suppress testosterone production. Over time, this pattern can leave you feeling more fatigued, less focused, maybe less motivated to engage sexually. You might even wonder, why don't I feel as driven as I used to, even though I'm still ejaculating every day? Well, this is one answer. You may be overusing a system that is already trying to slow down and recover. It's not broken, it's just asking for support, for rhythm, for rest. And here's where it gets interesting. Some men actually notice that when they slow down, when they space out their ejaculations by a few days or more, they start feeling better, stronger, clearer, even more sexually energized. Why? Because their testosterone isn't being constantly flattened by elevated prolactin. Their nervous system is getting a chance to fully reset. This isn't about abstinence, it's about alignment, about listening to what your body is telling you, not what your habits have trained you to do. Now let's shift focus and talk about what happens emotionally. Because let's be honest, sexual release isn't just about the body. It's about the brain, the mind, the heart. And for many men over 50, this is the part no one talks about. After climax, your brain releases not just dopamine and serotonin, but oxytocin, the hormone of emotional bonding. It makes you feel connected, safe, and close. That's why ejaculation with a partner often leaves you feeling more fulfilled than solo release. But when you ejaculate alone, and especially when it becomes a daily habit, some men start to feel the opposite. More detached, more emotionally flat, sometimes even a little numb. Have you ever felt strangely low after release? A mood drop? A sense that something is off or even missing? That's not just in your head. That's neurochemistry. And when those dips happen every day, they start to accumulate. They can lead to mood instability, irritability, or even low-grade anxiety. Again, this doesn't mean something is wrong with you. It means your brain is processing more than just pleasure. It's also processing absence, the absence of connection, the absence of emotional reciprocity, the absence of repair. So what helps? I always suggest this to my patients. Build a small post-release ritual. After ejaculation, especially if you're alone, pause. Don't rush into email or social media or work. Sit quietly for a minute. Breathe. Place a hand over your chest. Acknowledge what just happened. Tell yourself gently, "This was real. My body is safe. I am still whole." That small act of awareness can help your nervous system feel grounded instead of disoriented. Over time, it can protect you from the emotional drop that some men start to fear, but never talk about. Now let's talk about your pelvic floor. Yes, we're going there, because the truth is, your pelvic muscles play a huge role in your sexual experience and in your recovery. When you climax, a series of rhythmic contractions in the pelvic floor muscles push semen through the urethra. These muscles also support your bladder, your prostate, and even your rectum. But here's the problem. As men age, these muscles often weaken. Years of sitting, poor posture, lack of movement, and even trauma can lead to pelvic tension and dysfunction. When you ejaculate daily, without supporting the recovery of those muscles, you might begin to feel symptoms that seem unrelated. A dull ache in the lower abdomen, a heaviness in the testicles, a feeling of tightness or pressure behind the pubic bone, even changes in how you urinate, more frequency, slower stream, or incomplete emptying. Many men come to me fearing they have prostate issues, when in fact, it's their pelvic floor crying out for attention. And here's what I recommend. After each ejaculation, take 5 minutes to move. Walk slowly. Stretch your lower back. Rock your hips side to side. Take deep breaths into your belly. This simple practice helps release muscular tension, restore circulation, and protect your pelvic floor from overstimulation. Think of it like a cool down after a workout. The effort wasn't harmful, but the body deserves recovery. Now let's talk about the long game. Daily ejaculation after 50 doesn't always have immediate consequences. That's why many men dismiss concerns, because nothing feels wrong right now. But what about 6 months from now? A year? 5 years? When I see patients in my clinic, I'm not just looking at their current state. I'm looking at patterns, trends, early signs of wear. And one thing I often find is that long-term, daily ejaculation can begin to affect a man's energy baseline in subtle but real ways. You might notice your morning energy isn't what it used to be, not from poor sleep, but from depletion. Your workouts feel harder, your motivation slips, you start relying more on caffeine or pushing through mental fog. It's not depression, it's not illness, it's just a nervous system that's quietly tired. Not broken, just overworked. This is why I urge men over 50 to think not in terms of how often can I still do it, but instead, how often does my body truly recover? Daily ejaculation is not always dangerous, but it's often unsustainable, especially if you're not balancing it with movement, nutrition, pelvic floor health, and hormone care. Let's talk about the prostate. one of the most important glands in your body at this stage in life. The prostate is responsible for producing much of the fluid in your semen. It surrounds the urethra, and it responds to hormonal changes throughout life. Frequent ejaculation can, in some cases, have a protective effect on the prostate, particularly when done a few times per week. It helps clear out stagnant fluids, reduces inflammation risk, and may lower long-term prostate cancer risk, according to some research. However, daily ejaculation, especially without full pelvic recovery, can increase localized inflammation in some men. If you already have an enlarged prostate, also known as BPH, or symptoms like slow urine stream or frequent night urination, overdoing it can worsen these issues. This is why the key is balance. More is not always better. With age, health is no longer about what you can do. It's about what your system can sustain, without tipping into chronic tension or depletion. Now, we also need to talk about emotional intimacy. Because the truth is, ejaculation is not just a physical act. It's a powerful connector between two people. And in long-term relationships, the quality of that connection can deepen or erode depending on how we show up, not just sexually, but emotionally. When ejaculation becomes routine, solo, and emotionally disconnected, it can create distance in a relationship, even if no one says it out loud. I've seen this pattern over and over again. One partner feels neglected, the other feels misunderstood, and both are quietly hurting. The emotional and sexual circuits stop feeding each other. They operate in separate lanes, and eventually, a sense of distance settles in like fog. But here's what gives me hope. With awareness, that cycle can change. It doesn't require dramatic transformation. It starts with intention. If you're in a relationship, I encourage you to reframe ejaculation not just as a release, but as a communication, a form of expression, a choice to connect. Ask yourself, when was the last time intimacy felt truly shared, not just mutual but emotionally open? When was the last time you allowed the afterglow of release to lead to conversation, vulnerability, or even quiet presence? These small shifts rewire your nervous system. They reinforce emotional safety. They help you feel full after intimacy, not just spent. And if you're currently not in a relationship, this awareness still matters. How you relate to yourself sexually lays the groundwork for how you relate to others. When daily ejaculation becomes mindless, rushed, or emotionally numbing, it disconnects you from your own aliveness. But when it's done with presence, care, and intention, even alone, it can become a tool for renewal, not depletion. Now, let's be practical. If you're currently ejaculating every day and wondering, do I need to stop? The answer is not necessarily. This isn't about judgment. It's about tuning into what your body is telling you. If you're feeling low energy, mood dips, decreased motivation, changes in sexual response, or pelvic tension, consider spacing things out. Try every other day, or every 3 days. Then pay attention. Do you feel stronger, clearer, more engaged with life? There's no perfect number. Some men feel best at 2 or 3 times per week. Others need longer stretches. The goal isn't abstinence, it's sustainability. You're not trying to perform like you're 25. You're trying to live well at 50, 60, 70, and beyond, with vitality, clarity, and connection. Here's a simple framework I give my patients. Check your energy the morning after. Did you wake up feeling sharp, steady, rested, or groggy, drained, and irritable? Track your motivation. Are you still inspired to move, work, and connect with others? Notice your recovery time. How long does it take to feel fully you again? Pay attention to pelvic tension. Any tightness, dull ache, or urinary changes? That's data. Over time, you'll build a feedback loop. You'll stop guessing. You'll know what rhythm works for you, not based on fear, but awareness. And please, don't neglect your overall health. Ejaculation is just one piece of the puzzle. It interacts with everything: your diet, sleep, stress, alcohol use, physical movement, and social connection. If you want strong, healthy sexual function at 50 and beyond, you need to treat your whole system with respect. That means lift weights at least twice a week to support testosterone. Stretch and walk daily to relieve pelvic tension. Get 7-8 hours of real sleep, not just time in bed. Eat whole foods rich in zinc, magnesium, and healthy fats. Drink water, not just caffeine. Have real conversations with people you trust. These aren't just health tips. They're intimacy habits. Because intimacy isn't just about climax. It's about aliveness, connection, presence. And every part of your life feeds that, or drains it. Now, before we close, I want to speak to one final truth. There's nothing wrong with wanting pleasure. Nothing shameful about release. But the question you must ask yourself as you age is this: is this habit serving the man I'm becoming? Or is it keeping me locked in the patterns of the man I used to be? You are not the same at 50 as you were at 30. Your needs are different. Your nervous system is different. Your capacity for depth is greater. And your ability to feel, not just physically, but emotionally, is far more powerful than you may realize. Daily ejaculation is not dangerous. But unconscious ejaculation? That's what slowly drains your life force. So if you want to feel clear, connected, and fully alive in your body, then start paying attention. Slow down. Choose presence over pattern. Ask not what your body can still do, but what it's quietly asking for. You may be surprised at how wise and how alive you truly are. If this message spoke to you, I encourage you to take one small step today. Maybe it's skipping one day. Maybe it's journaling after release. Maybe it's simply observing how you feel without judgment. That one act of awareness is the start of transformation. And if you want more insight into men's health after 50, everything from hormone balance to pelvic support to emotional renewal, I invite you to subscribe to this channel. Every week, I share medically sound, shame-free advice to help you live your next decades with clarity, strength, and connection. You are not alone in this journey, and the more we talk about it, the healthier and more alive we all become. I'm Dr. VENA MALIK. Thank you for spending this time with me today.